All right. Dr. Mack here. I had a patient this morning who asked a really cool question, which is a question I get a ton in here, and I think I don't think the same way about it as you guys do. You may have more concerns about it than I do. So I just wanted to talk a little bit about that real quick. He was getting a big popping sensation in his upper left neck. It's creating a lot of pain, and it was very tight and restricted for him. It wasn't causing headaches at this point, which is really good. But he was wondering what the heck that was, and he kind of thought it was probably something worse than it is. Although really important to get treated by a chiropractor and these types of things, but very easy to treat as well. But what that popping noise is that's just gas pressure release from between your joints and your vertebrae. So when you think about what normal function is in a joint, joints should move, they should glide. What happens with people when they get pain and stiffness and tightness and headaches and all these things is the joints stop moving. They don't glide and move, and so what happens is the muscles tighten around them. We get inflammation, we get pressure on nerves that cause pain and headaches and referred pain in different areas. And what we do as chiropractic neurologists is we figure out where the source of this is coming from, which joints are involved, which nerves are involved, and muscles, and then we apply treatments to them to restore that movement. And what's interesting is that you might hear a little bit of a pop when we restore that movement, but that's just a pressure release, it's a gas release. Now, after we do that for a few treatments, the pattern changes, and now you can move your neck freely and all those good things without pain. But sometimes people can just hear popping in little, what we call crepitus, or it kind of sounds like grinding or feels like grinding. But that's just little bits of air and gas release from your joints. And it's not bones grinding on bones. It's not arthritis and these types of things. It's just a normal kind of sound or physiological response to what you would experience if your joints were not moving very well. So that's really where we're at with that one. Easy to fix. For him, it was an upper cervical vertebrae, a couple vertebrae that were just very restricted and tight. We located where they were and then treated them with a very comprehensive neurological approach, which is treating the joint, the muscle, the nerves, and the parts of the brain that are involved. And you can do that pretty well with a very good combination of care.